Hello, and welcome to this breakout session related to peer support. My name is Cheryl Holm-Hansen, and I provide research and evaluation support for the Hennepin County Children's Mental Health Collaborative. In this brief presentation, I will share some findings from our recent parent interviews related to peer support and highlight a few approaches for providing support. As described in the opening session, we recently interviewed 49 parents about their experiences entering the children's mental health system of care. Most parents struggled to find appropriate services and supports for their child. Many also talked about the stress and anxiety that they experienced while trying to navigate the system. Having a child struggling with mental health issues can be a stressful experience for parents. Many parents shared stories of their own struggles while trying to support their children. Parents sometimes felt overwhelmed by their child's needs or fearful about their child's future. Some parents sacrificed their own self-care to attend to their family. Parent stress was exacerbated by stigma for many parents. Sometimes this took the form of parents feeling ashamed of what their family was going through or feeling guilty that they may be responsible for their child's condition. Stigma also made it harder for them to share their experiences or to reach out for support from other people. While a few parents had access to a professional who helped them navigate the system, more talked about the importance of connecting with other parents. Connections with their peers were important in validating and supporting parents and identifying potential services for their children. When their child was first identified as having a mental health issue, many parents first turned to their own friends or families for support and guidance. However, it often became increasingly important for them to connect with other parents of children who have mental health issues. They found that these parents not only understood and accepted what they were going through, but also offered more suggestions for resources or services that could help. These quotes highlight some of the ways that parents talked about the importance of connecting with other parents that would understand what they were going through and who would offer support. Parents generally had to seek this peer support on their own, with social media being especially helpful in finding other parents. Some parents talked about meeting each other in provider waiting rooms. In some cases, parents would connect with others one-on-one, while others joined support groups or followed relevant Facebook pages. Access to peer support groups was one of the strongest recommendations from parents about how their experience could be improved. Parents who had not accessed peer support often suggested that that would have been an important strategy for improving their experience in the system. Those who had accessed peer support sometimes wished that they had found it earlier or easier. Again, these quotes reflect some of the ways that parents made this recommendation during their interviews. Not only did the families that we interview value and recommend peer support, but other research also highlights the potential benefits. A recent publication put out by the Substance Abuse and Mental Health Services Administration concluded that parent peer support can help increase parents' sense of collaboration, self-efficacy, and empowerment, while decreasing internalized blame and isolation. Ultimately, peer support can be an important resource for parents, offering opportunities to share information, provide navigation support, inform decisions, and build more productive partnerships with providers. A quote from a recent SAMHSA webinar on peer support highlights the unique value of peer support, characterizing it as being the only support in the children's mental health system that is uniquely and unrelentingly focused on the parent. Parent support is often provided informally through one-on-one relationships or support groups. Minnesota also supports a more formal parent support role through their Certified Family Peer Specialist program. Certified Family Peer Specialists work through mental health service provider agencies to support families. To be a certified specialist, you must have a child with a mental illness and your own firsthand experience navigating the system. You must also complete training and a certification exam. Certified Family Peer Specialists will work with families of children or youth who are receiving mental health treatment in efforts to promote family resiliency and recovery. They provide non-clinical family peer support that builds on the strengths of the family and helps them to achieve their desired outcomes. The remainder of this breakout session will focus on strategies that could help strengthen informal or formal opportunities for parents to receive support from their peers. Thank you.